us briefly about Okadoc, when it was established, and how does it work?
Sure. So Okadoc was established about 2.5 years ago in the UAE and Indonesia. And Okadoc is a platform for patients and for healthcare providers. So for patients, Okadoc allows patients to book an appointment in less than a minute, actually in less than 40 seconds to be precise, to be able to cancel an appointment, reschedule, and request earlier availabilities. But it also helps them search and find a doctor based on their needs, by specialty, by location, by insurance and plans that are accepted, and more. And from a healthcare provider side, it's a platform for them to offer a 24/7 booking solution to their patients, but it's also a platform that reduces their no-show by up to 75%, allows them to improve their operational efficiencies and more, basically.
How do you evaluate Okadoc's performance since its establishment, and what are the main factors that contributed to this success?
So the performance has been very good so far. We're very happy of the adoption of Okadoc's technology from both patient and healthcare provider. So we've seen a great acceptance, a higher demand to the kind of solutions that we are offering. What we see is that the performance can be translated in different factors, right? In different KPIs. We see the number of appointments that has been growing on a triple-digit on a yearly basis, the number of doctors that are live and bookable, but also in terms of revenues as a company, we have been growing on a triple-digit basis year on year so far.
Okay, how did the coronavirus pandemic affected Okadoc? And do you think it will be more difficult to raise funds after this pandemic and liquidity shortage?
The COVID-19 has definitely given an acceleration in adoption to telemedicine. At least 2 years of what it would have taken for healthcare provider and patient to kind of adapt to a new consultation method like telemedicine, right? And that telemedicine is a great. We've seen a great adoption of telemedicine from a provider side, from a patient side, and actually, due to the COVID-19 pandemic, we got to do pretty much everything through teleconferencing too. So it's not only people getting used to that for telemedicine only, but being used to having an interview with a journalist through Zoom. But kids are having everyday education, continuous education with their schools through a Zoom or through a teleconferencing tool.
So, do you think it will be more difficult to raise funds in light of this situation?
Look, overall, the global situation is showing that there is definitely an hesitation in investing in general. Right now, we've seen the market crashing in some countries. We've seen a lot of stimulus and support from governments. But overall, in this kind of situations, investor will hold on cash and wait to see how the situation would be. And a lot of companies are not able to operate, so a lot of investors are also being impacted by some other businesses that they have, and therefore having incurring massive losses on other businesses. So definitely, globally, there will be an impact on investment. Now, when it comes to health tech, we have seen some of the largest telemedicine platform in the US being listed on the New York Stock Exchange, who have doubled their valuation in the first quarter of the year, while all the other markets were going down. So I think we will see a greater investment in the telemedicine or health tech companies, especially right now. But there will be still difficulties in fundraising, even for health tech companies. I mean, there will be more interest in health tech companies, but investors would look at more sustainable companies that are able to generate profits sooner than what they used to accept in the past. So investment might become more and more difficult in the next 1 year.
What is your big picture vision for the future of Okadoc?
Our mission as a company is to improve the healthcare experience for all, and everything we build is always around that mission. So what we see for Okadoc is continuing delivering this mission of improving the healthcare experience for patients, for healthcare providers, for doctors, and other people involved in this process. So we see it as expanding this mission beyond the Middle East. We already launched Indonesia. We're looking at more countries. So yeah, we'd love to continue our mission and take it to new geographies.
Okay, what do you foresee as the largest challenges to scaling Okadoc in the MENA region?
The largest challenge that we see is the adoption from healthcare providers, from patients. They have been used to a traditional way of booking when it comes to appointment, or in terms of having just normal consultations on a in-person, like going physically to a hospital or a clinic. And the biggest challenge would be, like any other industry that went digital, to increase the adoptions from both sides, right? And as I was saying earlier, COVID-19 pandemic has accelerating this adoption, so which is a good thing for this industry, unfortunately.